Hi, good afternoon, everyone. I'm just going to let other people kind of slowly stream in, and then I'll get the session started. Well, good afternoon, everyone, and I want to thank you for joining us for day 2 of our Family Councils Ontario Innovation Summit. We had some excellent sessions yesterday led by Hannah on quality improvement, and then by Nadine and Tara on palliative care, and a really good interactive session. So today is going to be a lot of fun because it's a chance for you to learn about some new or innovative products that are available within the long-term care sector, and for you as family members to ask questions and hopefully get some ideas that you can bring back to discuss with your councils and then within your homes, just some different ideas about what you could implement to improve the quality of life for residents. And there's lots of options out there available. So before we go any further, I'd like to take a moment to acknowledge the land on which I'm coming to you from. I'm based in Ajax, which is situated on the traditional territories of the Anishinaabe, Mississauga, adjacent to the Mississaugas of the Scugog Islands First Nations, and the territory covered by the Williams Treaty. Family Councils Ontario was founded on land that is in the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. As a remote team, we encourage our team members and service users and partners to reflect on colonialism's enduring legacy and engage in reconciliation meaningfully. We encourage everyone to visit nativeland.ca to learn more about the territory in which you're home or where you are located and joining us from. The work that non-Indigenous organizations and individuals need to do towards reconciliation with Indigenous peoples is a long-term journey, specific to each individual, and is constantly evolving for our organization. We welcome you to join us in our journey. So I am so excited to have a number of different organizations joining us today. They're each going to present to you for a little bit, and then there'll be an opportunity for you to ask questions. So the first organization that will be joining us is Ambient Activity, and I've met them and I've learned a little bit about what they do through AgeWell, but also just in general, just I've read articles about them and their product and what it is that they offer to long-term care homes. So I'm going to hand it over to Ambient Activity, and they will be the first organization to be speaking to you. So they'll present a little bit about what it is that they do, and then you'll have a chance to ask them questions towards the end of their presentation.
Thank you, Kathleen. Can you hear me okay? Okay. So it's Mark Canik here. Now, am I going to be able to demonstrate visually? Is my camera going to be turned on?
You should be able to turn your camera on. Let me see if I can help you with that. Give me a second. I'm going to pause.
So we're Ambient Activity. We're located up here in Midland, Ontario, on the shores of Georgian Bay. We started out, boy, oh boy, 25 years ago, building activities for children. And this is where we were cutting our teeth on learning how play or activity can be used in a therapeutic manner. About 5-6 years ago, we were asked to bring one of our activities into a long-term care in our area. And this was the first time I was introduced to the challenges of responsive behaviors in people living with dementia, and just understanding really that the quality of life for people who are living with dementia is almost exclusively dependent on that quality of care by empathetic care providers, those direct care providers. That includes family members. And so we that's where we started our journey, and we developed a category of products that are known as ZETs. These are zero effort technologies. So understanding that there just is very limited resources in the healthcare system, particularly these days, what can we do to embed technology, not to replace, but to augment or support care providers by having technologies that can be accessed, self-accessed without little or no support by direct care providers. So I'm going to present to you, two such activities. The first one is what we call Abby. Ta-da! And Abby is a activation product used primarily in long-term care facilities. So understanding that people who live with dementia will lose, firstly, declarative or explicit memory, but will retain to some degree implicit memory. So residents still can pet a cat or turn a wheel or push buttons or whatever. So if we can utilize, using Montessori principles, that remaining ability to give a resident some sort of media memory trigger, then that's what our intention is. So Abby is mounted in the care environment. It's just meant to be ambient. We're called ambient activities, just ambient there, available 24/7. So it can be accessed by those wandering the halls at 2 o'clock in the morning. It's meant to look nostalgic. It's kind of a radio sort of look to it. And so when residents come up to any of these interfaces, such as petting cat or turning a wheel, turning radios, pushing buttons, it'll have some sort of media response. We hope that's appropriate for the resident. Now, Abby operates in 2 modes. It operates in what we call community mode, and anybody and everybody who interacts with Abby will receive or be receiving the same media content. And that media content is managed by what we call kiosk managers. Typically, they're the rectees or the activation coordinators, and they're able to go on a administrative portal specifically for Abby and upload content. So that's community mode. You'll notice I'm wearing a beacon. Doesn't have to be worn this way. It could be worn on an appliance or an article of clothing. And this is for personal content mode. So when I, for example, go up to it, to Abby, and I start engaging with it, and I don't know if you can see this, and my name is in the bottom left-hand corner here. So I know it's in what we call personal content mode. So family members can also go to that same exclusive website portal and upload content that would be meaningful to me, whether it's a snippet of a song or it's a video or something like that that would be meaningful to me. These are my granddaughters. Then that's the idea. So this is a way for a technology to allow family members to participate in the care of their loved one in care. So we have these tangible switches. We also have some activities that are perhaps more for those that are more cognitively able. So pushing buttons and popping balloons, matching pairs, and it gets more difficult as it goes on. And there's more games here. And the games also can be, there's a variety of games, and these games can be directed towards an individual, and different game levels can be provided for residents to their level. Okay, so Abby requires power and it requires internet. And I think that's the Cole's notes on Abby. Kathleen, is it appropriate to stop and ask for questions now before I go to the next product?
Absolutely. Feel free to, if you have any questions, type them in probably the Q&A as opposed to the chat feature, and then I'll be happy to pass them along. But thank you so much for showing us Abby. Abby is what I've heard about. I forget, it might have been when I was at the Toronto Rehab Institute. It might have been one of the developed there. And it's really cool to see that it can be personalized, but that it's there. It seems like, especially because of the nature of what it is, when it comes to an outbreak, that would be very easy to clean the touch surfaces.
Yeah. Thank you for pointing that out. So the cat fur really isn't cat fur. It's full fur, and all of our products are coated with antimicrobial additives. So you can use any type of Virox cleaners or anything like that to wipe the unit down.
Perfect. So I do have a question. Someone was asking, how much is an Abby unit?
They are selling for $8,950, $8,945.
And then once it's purchased, are there typically any additional fees?
Nope.
Okay. So once you purchase it, it's the homes.
Correct. Now and Abby can operate without the beacons. And I apologize. There is a cost for beacons afterward if they're wanted or required. What we typically advise facilities to do, we give each facility a beacon to trial to see whether or not it makes sense for residents, whether or not family members want to participate. So the beacons afterward are $95 a piece per individual, or you can buy them in packages. But typically we find that a facility needs, a rec team needs to sort of understand how to use this tool properly. So they get it, they build a community mode, they see who it is that interacts with it, they trial a beacon, and then they have to make it known to family members how they can participate.
Wonderful. So have you had homes that purchase it and then families will approach to purchase the beacons themselves without the home coming to you?
That's typically what happens. The family councils then buy the beacons.
Perfect. Can you describe the profile of the resident who typically would come up and independently use the Abby?
Well, that's a very interesting question because dementia lives on a spectrum. And most people in long-term care will have dementia. Almost half will have some form of responsive behavior, but that range is wide and varied. So what we shoot for are those individuals. What we try to aim for are those individuals that are able to activate, so they have movement, and they're able to understand the media that's coming to them, and then how the family members and how the kiosk manager creates the media that a resident would be able to digest really is a dance, is an understanding of that resident. It's more personal care, more person-centered care sort of philosophy sort of thing.
Wonderful. So where typically or how is Abby mounted to the wall?
Yeah, so there is an offset wall mount frame. So typically these go in wandering hallways above the chair rail. It does get mounted to the wall. We want it to be stationary. We don't want to have care providers moving it in and around. It's meant to be ambient, and we're not trying to create more work for the care provider. So there's an offset wall mount housing that sits above the chair rail, and the Abby unit gets attached to the offset wall mount housing, and it sits proud, roughly 8 inches off the wall.
Thank you. So because the beacons kind of have those videos, where's the data stored and where is it uploaded to?
Okay, so to be clear, there's nothing on the beacon. All the beacon is an identifier. So it is a tag that identifies a particular individual on the computer inside. So there's a computer inside, and there's storage inside. That's where the media is stored. So the beacon there's an immutable number for an individual. When the Bluetooth reader reads the beacon number, it knows to go to the file of that resident stored on board the computer.
Awesome. Yeah, someone was saying they have an Abby in their home and it was well received, but they weren't aware of the beacon function. They don't have that. So maybe hopefully you'll be able to go back and have a conversation with your home about the beacons, and as a council maybe looking into being able to add the Abby if it was well received by adding those personalized videos and aspects to it. So because there is with the beacons that option to personalize things, how can families provide content?
And so to that person that was unaware of the beacon, and it really goes along with the ambient access website. So in all fairness to that family member and or facility, this is a relatively new development for us. So family members go to an administrative website. It's called ambientaccess.com or ataccess.com. And they are onboarded, they register, and it's free of charge. And the rec therapist does that for the family members. They're assigned to their resident, and then they're able to access a resident's dashboard and upload content similar to what we do with other platforms. So for example, there's a place there if you wanted to add pictures or content for pictures. There's a picture thing here. Then it says add picture here. You can add JPEGs or MP3s, MP4s, and it gets loaded to that person's profile. So it's all done on an administrative website.
Wonderful. Is there a maximum size to the files that they can ask to be uploaded?
1 gig. I apologize. 600 megabytes. For one file. So
yeah, wonderful. Thank you so much. So those are all the questions, but lots of great questions and discussion. And I'm excited to hear that there was a home that has the Abby in it and that they're learning a little bit more about what they can go back to the home and have a conversation about of, hey, you want to add these beacons in to make it a bit more personalized for residents.
If you would permit me one more comment on Abby. What we found, and we weren't expecting this, but what we found is that Abby provides a way and means to enhance family visitations. So the challenge is that when you go visit your family member, it's perhaps sometimes difficult to have a conversation, and it can get frustrating. So by sitting in front of an Abby together with family members, you can review past memories, and it enables or enhances family visitations. And we just weren't aware of that. And it perhaps one of the biggest compliments, attributes of the product is its ability to enhance family visitations.
Wonderful. Well, it sounds so exciting. And thank you so much for speaking about the Abby. And were you going to move on to another product you wanted to share?
Sure. How much time do I have?
You have lots of time.
Okay. So I'm just going to turn my fancy rig around. Okay. Okay, so apologies.
No worries. When you have to set up and show all the really cool toys, it sometimes takes time to reorient everything. But this looks equally as interesting.
So this is another, what we refer to is as a zero effort technology. And again, the importance of trying to embed technologies that do not place more burden on limited staffing resources. So if we can provide means for residents to access these things on their own accord, this is our objective. I see that the image is not so clear, so this might be a challenge, but at least you can get the sort of overview. This is Genie. This is not as much for activation, but is more for communication. And so what we're trying to address with Genie is, what do we do with those folks that have challenges negotiating smart technologies as they exist today? So the notion of social isolation, or the challenge of social isolation. So Genie is an easy to use communications platform designed for people that perhaps cannot negotiate smartphones or smart technologies. It requires a smartphone for family members. So family members download an application onto their smartphone. They're able to send messages. The messages can be video, they can be pictures, they can be text, they can be songs, any type of media content. A resident has a key. The resident inserts the key into the key holder. On this kiosk, there's only one resident, but there could be 10. There's the key number. This particular resident, you can't see that, his name is Alan. So when all Alan needs to do is to push go, and all of the messages sent to him by the family members on the mobile app will be delivered to Alan, and he can receive these on his own accord. He can reply back to each message, and he can just simply press go to the next message. So really, all new messages Alan needs to do is just to press go. So that's Genie, and it also works with a smart device. It requires a smart device, the kiosk, Genie kiosk, that family member residents interact on. And again, family members and kiosk managers, typically the recreational therapist, manage the connections between the resident and the family members on the Ambient Access Administrative website portal. There.
Very cool. So it sounds like that's a good option for someone that maybe, a smartphone is a little bit odd for them to have. It's got the old school phone, without the dialing. I was surprised. I took my daughter to somewhere and she knew what the dialing part of the phone was, and that the rotary dial was. It really surprised me. So when it comes to the Genie, what is the cost of a Genie unit?
The cost of Genie is $8,450, and it's a one-time cost. There's no ongoing fees.
Wonderful. And then is there a limit in the number of keys that are provided to the home, or is that something that like a family would purchase for their resident?
Unlike Abby, so the price for Genie includes 10 keys, and then keys after that are $95 a piece. But to date, we've not had the product is relatively new. We don't have as many of these across Canada at this point. The product is being trialed in New Brunswick. We're Mount Allison University. We're looking at usage and its ability to affect health outcomes. To date, we have not had a facility ask for more than 10 keys. So that gives you sort of an idea of what the usage is.
Yes, absolutely. I'm trying to think what other, so I know that they asked about cost. Does it normally stay in the same location in the home, similar to the Abbey?
Well, that's an interesting question. We initially thought, because that was the ask, we were asked to develop this product before COVID. And so the idea was that it would be in a central area, available to everybody. But of course, then, and it wasn't going to be on a stand. And of course, COVID broke out, and the first thing we needed to do is to make it mobile. So it's on a stand and it wheels around. So it's flexible. It can be in a common area. We like these things to be in a common area because they're seen and they're visible and they can be accessed. My challenge with having things mobile is they sometimes get stuffed in a room and not used. So it's really up to the facility and the rec therapist how it is they use their tools.
Absolutely. Someone asked, so when a resident either passes away or moves on, can the keys then be transferred so another resident could use them?
Yep. And that's done on the administrative website by the kiosk manager, typically the rec therapist.
Wonderful. And so, as you said, this was something that you were developing before COVID happened. With COVID, was there more of an interest from homes to pilot the Genie in the homes?
Yes. You know, that the problem was that these poor, the heroes, the empathetic care providers, they're simply run off their feet. And as they're trying to provide activities, I mean, their activity was basically running around rooms facilitating, you know, virtual conversations, Zoom conversations and FaceTime and all that kind of stuff. And so, you know, that's the big challenge is that just there's not enough resources to facilitate the connections. So this product is being asked for quite a lot now.
I like that it also makes it so the issue I've noticed with tablets or a smartphone is that if people go back and revert to their long-term memories, well, technology like that is so new that it's so foreign to them. Whereas what you have the phone receiver that they can pick up and talk into. So it's probably much easier to prompt those cues of what to do to engage in communication, because they've used phones all their lives and talked into phones like that. So it's really exciting that it kind of takes a little bit of the knowledge and, you know, best practices that are out there about what we know about people with dementia and tries to incorporate that to make it easier to communicate.
Correct. And again, the camera's not, you don't see the screen, but we're at all stages, we're prompting either video and audio cues on what the resident is to do next. Press the go button for the next message. You know, this is always prompting. We employ Montessori principles wherever we can.
I am so excited to kind of hear a little bit more about Genie as it continues to evolve and as you get more people onboarded with using it in their homes. But thank you so much for taking the time to speak to us about both the Genie and the Abbey. Like I said, I've seen the Abbey, I've heard about it. I was so excited to bring that for discussion, but Genie again is another alternative that exists for promoting communication with residents and their loved ones out in the community. So thank you so much. Really exciting, innovative products.
Thank you for this opportunity. And if I can shamelessly promote ourselves, please check out our website at ambientactivity.com. You'll get to see all the information on all these products there.
Thank you so much. You have a wonderful afternoon.
Thanks, guys. Thank you, everybody.
All right. We're back. So thank you so much. So that was a great start to our session. I'm really excited to introduce you to our next organization, Evoke Health. They contacted Family Councils Ontario, I want to say in the summer. And this is a really exciting opportunity for them to come to you and ask you some questions and share a little bit about what their new innovative product is. And I will give them a plug that they were at the OLTCA conference. So the organizations and homes that are part of the OLTCA are aware of their existence. So if you're part of a home that is part of that organization, then if you're interested, then you'll be able to bring this to the attention of your home administrator and maybe ask to say, hey, have we thought about piloting or implementing Evoke Health to promote communication? And I'll turn it over to you, Varsha.
Oh, Kathleen, that was such a wonderful introduction, and you stole my sales pitch, but thank you so much. I don't have to do that. I'm just going to share my screen. I have to say, I don't have any fun toys like ambient activity, just a software technology and a presentation. So I hope it's interesting, and you guys can take something out of it today. Can everybody see my screen? Oh, please.
Yes, it is.
Okay, awesome. Hi, everyone. Before I start, I want to tell you a story about Jane that I feel a lot of attendees today can relate to. Jane is part of the sandwiched generation. She has teenage kids, she has a full-time job, and she's also a power of attorney care for her mom who lives in a long-term care homes. Jane loves her mom dearly and worries about all the time. She doesn't have the luxury to visit her daily. As a result, she doesn't know how her mom is doing unless she calls the nurses or the staff in the long-term care home for updates. And as we all know, the staffing shortages have just overburdened the staff with resident-facing responsibilities. So at the end, Jane is anxious, has tremendous guilt, and all she wants to know is that her mom is well taken care of, is safe and happy. Jane is one of 8 million families in North America who are in a similar situation. My name is Varsha Chaugai. I'm the CEO and co-founder of Evoke Health. We've heard the families cry for help, and we are answering it with our family portal, Engage Plus. In the session today, I'll talk about what Engage Plus is, and we'll dive into a real use case story of how, for one of our customers, our technology has brought tremendous peace of mind to families who have loved ones in long-term care homes while saving their nursing team significant time on communication. Engage Plus is really a simple and effective way to keep families always informed. It's a web-based portal and also a mobile application that automatically and in real time lets families know how their loved ones are doing. And we also provide a secure channel for families to directly message the care team for information, replacing the tedious and time-consuming phone calls. How we work is we directly pull information from whatever electronic charting software that the homes are using so that the nurses or the care team don't have to enter any additional information into our portal, and the data and information is seamlessly flowing into our technology. So our solution is really as simple as nurses doing their routine charting and families being instantly updated, saving many, many hours of phone calls, emails, and the frustration that comes with not being able to communicate properly and not having access to information on your loved ones. Since we are dealing with sensitive health information, we are in compliance with all the applicable privacy laws such as PHIPAA, PIPEDA, HIPAA. We have all our data are encrypted. We have strong security controls, and our platform is very secure. Over the last 2 years, we've had the opportunity to talk to almost hundreds of nurses, director of nursing, CIOs, administrators, executive directors, family councils, lots of family councils of long-term care homes here in Ontario. And what we've learned is that keeping families informed and keeping them in the loop of their loved ones' health and care is such an essential part of providing a person-centered care that all the homes are now moving towards. But the communication method that are currently used is really broken, archaic, do not keep families adequately informed, and just add to the burden on the staff. So our goal with this platform is to really, how do we proactively equip families with information so that they can navigate their loved ones' care decisions without having to constantly call the nurses or the staff in the long-term care homes for update, and also just being able to go and visit your loved ones rather than trying to chase staff for information on how your mom is doing. Some of the features that we have in our platform is all the health information that is coming directly from the electronic charting software that the homes are already using, such as weight, blood pressure, sugar level, temperature, any vitals, the health conditions that the resident currently has, their allergies, immunization, the lab results, the medication, care plan. I know by law, the homes are required to share care plan with families on an annual basis during the care conference or whenever it changes. If it's happening, that's a different story, but they are required to share that information. Not all questions from families can be answered by just providing them access to the chart. So we have our messaging feature, which has been a game changer for our customers who are using our platform, because questions like, did mom sleep well? Did mom eat well? Or how's mom doing? It can all be channeled through our messaging feature rather than playing phone tags. Homes can also use our technology to send mass announcements such as any facility-related outbreaks, updates, anything that they want to share with families. We also have document sharing feature where families can upload care stories, care preferences, any historical documents, any documents that they want to share with families, and also staff can also share any documents that they want with the PO care through our portal. We also have appointment scheduling where you can schedule any visitations or any upcoming appointments, schedule care conferences, see the upcoming appointments of the residents, and also homes can share newsletter, activity calendar, food menu, anything that they want to share with families can really be channeled through our application. And one of our future feature that we want to add is to also add a family council element where family council can share their information with their council members. Okay. Before I dive into the case study, I actually want to learn from you how the communication with your home is and how often are you talking to them, trying to get information on your loved one. So Kathleen, do we have the polls? Awesome. Kathleen, do I have to end the poll? Awesome. Okay. Okay, I think the results are in. Can you see my screen where the polls results are? Okay. Well, if you're not able to, I'll just say one of the questions I asked was, how often do you communicate with your home? A lot of people said, most people said less than once, 1 to 2 times a week, 3 to 4 times a week. And how do you feel about the communication? 50% people said, it's okay, but it can be better. And 33% said it's not good, it's poor. And 17% said it's great. This is really good result. Thank you so much for sharing with me. And this translates to what we saw with our customers during when we were doing the case study. So let's dive into the case study. So this is a case study about 120 long-term care long-term and short-term care home called Shenandoah. The clinical team were finding that their staff were getting a lot of phone calls from families wanting to know information how their loved ones were doing. A lot of them were asking access to the care plan. At the same time, staff also had to call the families to let them know if there was any change in the health status. It was during COVID, so there was a full-time staff hired to just make visitation, punch in the appointments. And since we are in healthcare, everything had to be charted. So the staff were also charting any kind of communication that was happening with families. They had one full-time staff just scanning documents that the families were providing. And the home were also sending mass emails, letting families know what was going on at the home. And there was one person just maintaining the mailing list to ensure all the families were up to date. And this communication, of course, is a part of providing resident care, but the director of nursing alone for our customer was spending 4 hours of the day just answering questions from families. And even that wasn't enough to let them know how their loved ones were doing. So at the end, the staff were trying to do their best and families were just not happy with the level of communication and access to the information they were having. So the leadership team at Shenandoah were looking for a way to automatically keep families informed, give them access to the information that they were looking for, and also reduce the volume of phone calls that was coming to their staff. And they chose our application because we connected directly to the electronic charting software that was already being used, and also for our messaging feature. In terms of implementing any technology can be such a painful and long process, and keeping that in mind, we've tried to make our implementation process really easy and intuitive. The implementation process for our customers really took 3 weeks, where the administrator went into the electronic charting software, did 5 clicks, and we went live. They also wanted some customization that took us 2 weeks. We gave one demo to the director of nursing and assistant director of nursing on what the technology is all about. Till date, we have over 2,500 users, mostly families who have spouses in these long-term care homes, so 70 plus elderly adults. And we haven't had to give any training to any of our users on how to use our platform. It's so easy and intuitive to use. The way we onboard our families, all automated through the charting software that the homes are already using, and only authorized family members who have consent are allowed to sign up, are invited to sign up for our platform. And then we go live, and then families are just glad to have access to all the information. So it's a very easy process, does not add any burden to the care team at all. And I'm going to go tell you about what life looked like for our customer before our application and what life looks like now. So before our application, families were calling, they wanted more information, they wanted access to the care plan, the medication list. And after our application, families have 24/7 access to the loved ones' health information. This is all real time that is accessible through any device, anywhere. The phone calls are still coming in, but those are only for emergency situation or any in-depth medical conversation that the families want to have, or the staff want to have with the families. And some of the feedbacks that we've received from our family users, as you can read over here, is that this patient portal has been exceptional in terms of providing information. They're not able to travel or visit, and having access to the records bring them peace of mind, and they don't have to keep calling and insisting on information on their loved one's care. And this is exactly what we were trying to achieve with our platform, where let's keep families informed, let's automate the communication process so that families have the confidence in care that is being provided, and staff can focus their time on work that matters to them, which is resident-facing care. For the staff, our messaging feature was really a game changer in terms of streamlining communication, where they said that they could have never, and this is Director of Nursing saying, they could have never kept up with questions from families without the messaging feature. And they also feel that there's a significant decrease in phone calls, especially when there's a simple questions like, how's mom? Did she eat well? Did she sleep well? They can just shoot back a quick reply, and families being able to see health information has been a big help because the questions are more focused towards residents' well-being. And the messaging feature is not just used to just answer questions from families, but also staff are using it to let families know of if there's any non-urgent changes in the resident status, if they want the families to bring any clothing or any tools, anything that is non-urgent, they're using our platform to do that. And one of the good thing about our messaging feature is all the POA care who are authorized to receive information gets access to all the information, can see all the messages. So sometimes our staff say that families were saying, well, you told my sister and you didn't tell me. That problem is eliminated by our platform, where all the POAs are constantly kept in the loop. Again, before our application, staff were scheduling appointments through phone calls. There was a person responsible for scanning documents and maintaining the mailing list, whereas after our application, all that is done by us automatically. Appointments are booked using our application. All the announcements are done using our application. Care conferences are done through our platform. And as you can read this testimonial here, where the director of therapy felt that the calls have decreased and there's less confusion on whom to speak, not just for the family, but also for the staff. In terms of how often our platform is used by the families, till date, for all the families that we've invited to register for our application on behalf of our customers, 80% of them have activated their account. And out of the 80% of families, 90% of them are logging in weekly to check what's going on with the health and care of their loved ones. And all our activated families are logging in at least once a month to see what's happening with the health and care of their loved ones. And as you can see, the testimonial here from family member again, that this has been so helpful and informative and has really helped them keep their mind at ease. Some of our highly viewed features are care plan. Everybody wants access to the care plan. I don't understand what care plan is, but there's a lot of good information for families in the care plan. Messages, just from one customer, we have 5,000 messages that has been sent to and fro from families and staff in the last 1 year. Medications is another highly viewed features, and vitals that includes weight, blood pressure, blood sugar, any vitals that the homes want to share. In terms of benefits of our technology has been a game changer for our customers in terms of their communication process. The staff are seeing 40% reduction in phone calls from families that have saved them 40% time on communication. And I have to say, this particular case study was done on a short-term and a long-term home, and most of the residents were short-term, less than 1 month, so they had a turnover of 90% every month. So we feel like for a long-term care home with a low turnover, we'll have even a bigger time saving. Our customers are being transparent in the care that they are providing with the families. And as a result, families are able to trust the care, which is so important for the senior living homes to rebuild coming out of COVID-19 pandemic. And again, since families have access to the information, they're able to see what's going on, they're able to form that good care partnership with the staff. Whenever there's an issue, they're able to collaborate with the staff and work together in resolution of any issues that are not only improve the quality of life for the resident, but also enhance the family satisfaction and the staff morale as well. So to summarize everything, patient portal is not a new concept in healthcare, but it's definitely a new concept in senior living homes, in long-term care homes, assisted living homes, memory care homes. I'm sure we all, as part of the healthcare system that we consume, we have patient portal for our doctor's office, we have MyChart in hospitals, but we don't have anything for the long-term care homes. And what we learned from our case study and our pilot with this customer was that a patient portal or a family portal in a long-term care home setting, if it incorporates all elements of communication and information sharing that is happening today between families and care team, it will really save time for the staff, enhance productivity, and empower families to be equal partners in the loved one's care. We live in a world where we all are constantly connected, and no son, daughter, or spouse should ever wonder how their loved ones are doing. So it's time we open up communication channel in the senior living homes, and at Evoke Health, we are successfully doing it for 2,500 families. Help us, join us to reach 1 million families by 2024. Thank you.
Thank you so much, Farsha. And I'm going to say, if you do have any questions for her about Evoke Health, please feel free to type them in the Q&A. I know the chat isn't working, and then she can see them and I will also ask them. So I have a question about cost. Yes. So does a home pay a fee like to sign up for a year, or is it like a month by month fee for the home?
Right. So we follow a subscription-based pricing model that right now we are charging the long-term care homes directly because we need to integrate with their system, and we are providing this service in their behalf to their customers, who are the families and the residents. So we follow a monthly fee. The homes are welcome to pay annual subscription fee as well, but usually our current customers are paying a monthly fee that we charge based on how big the home is and how many features that they want to use. So for a typical 100-bed size home who want to use all our features, we charge around 400 Canadian dollars per month per home, irrespective of the number of families who are using it or the staff who are using it.
And so for Evoke Health, so obviously you've got kind of two users. You've got the staff and then you've got families. Where are you finding you need to provide support for the end user and how to use the app for communication? Is it with staff in the home, or is it more in supporting families with how to use what they can access and engage in that two-way communication with the healthcare team? Right.
Thanks for that question. So in terms of support, we've not had to provide any support to the staff because our platform is really easy. As I said before we went live, once our customer had signed the contract agreement, we gave one demo to the director of nursing, and then we onboarded all their staff, and she just told, hey, nursing team, go and use this platform. This is the login, and they logged in and they just started using it. But we do get support questions from families. Sometimes the link expires to activate their account, or sometimes the security questions that we ask, they may not know the answer to. So I think that's the only support we've provided till date in terms of just giving them a new link or telling them, guiding them a little bit on how to answer their questions correctly. In terms of usage, we really had to provide no support at all till date. And we have lots of users who are 70 plus because we kind of collect those data. So we see a lot of the people are spouses who are kind of giving us feedback saying, oh, I love this technology, it's really helped me. So.
Wonderful. When it comes to things like security of the data, especially for, people who are going to be accessing, have you had any concerns from families or from homes about making sure that the information is safe, especially because it's sensitive, like healthcare information per se? What have been the concerns or questions you've had about that, and what have you had to do to address to make sure everyone's information stays safe?
Right. Right. No, that is always one question we get because we are in healthcare. And I think there is a very good policies in place that we have to abide by. Anyone who's dealing with health information needs to kind of go through all the checklists and all the risk and security controls that HIPAA and HIPAA sort of ask us to adhere to. So in terms of security, we use state-of-the-art data encryption. All our data is hosted on secure cloud. We only provide access to those families whose information is there in the residence chart. So oftentimes in terms of support, we get questions like, hey, I love this tool. Can my brother have access to it? And we tell them no, until the homes put the person in the system using this particular check we have, they cannot get access. And we have almost 3,000 users and we haven't had any security issues. And we also have all the audit logs that as a part of a software technology, we need to constantly check and make sure there's no phishing or hacking or any kind of unauthorized attempts. So we've been very diligent, and both myself and my co-founders, we are biomedical engineers. So security was our number one priority when we were building this technology. So I have full confidence that my platform is very secure, and we've been live for 1.5 years now, and we haven't had any security issues.
Perfect. Thank you so much. I know I had to ask the tough question. I'm wondering, have you had requests for, I know it gets like information about vitals, but I'm wondering if homes have thought about adding, or families have requested things like images. So if there's like a bed sore or something has happened, have you had requests for people to include in the digital health data, images or pictures of the resident, so that way families who can't physically be there can see what's happening to that individual's health?
Right. So that was actually asked by our customer, because when we had given them a demo, we didn't have that feature where they could share images or any other files. So they asked us if we could add that as one of our features, and we worked on that. So we have a feature where staff can share any images, not just of bed sore, but happy images, sad images, worrisome images, any documents that they want family to review or family want to share. So we do have that section in our platform.
Wonderful. Thank you so much. I'm not seeing any questions, but I will make a comment. So my mother, she is the primary, I guess, health power of attorney for my great aunt, who is in her 90s, who lives in Michigan. And she lives in, and I've learned so much about the differences between the Canadian and American health systems just by the different names that they call things. And so she's in an assisted living home. She obviously at 90 has some form of dementia. And the issue that my mom would have was during COVID, she unfortunately wasn't able to communicate with the home, and a few things. The quality of service there there's a lot of turnover, a lot of transition, but she couldn't get the answer she wanted. So it's exciting to hear something like this, because I almost want to, let her know and ask her to ask her home, like my great aunt's home, to implement something, just so she has the peace of mind of knowing like what her weight is, because I know weight is an issue, or just knowing, has she had a fall, has she left her room, has she had social connection, which are very challenging things. So it's really exciting to hear that you've accomplished something to try and give families peace of mind and promote that communication in a way that, as you said, it's not creating extra work for the staff. It's literally just pulling data that they're already doing as part of their jobs and making sure that families can access it without having to know who it is they have to track down to ask that question.
Exactly, and that's exactly why our customers came to us, because they wanted to let families know, and I feel like the more the home is involved in keeping their families happy, the more there's a need for technology like ours that will help in communication, and without adding burden on the staff. So I'm really glad to hear that your mom wanted access to the information that we provide. So I'll send you an email on what that home is, and maybe I can contact.
I will try, yes. I did want to ask you, so when it comes to homes implementing Evoke, is it more the home would come to you, or is it something where maybe like family councils who are here, who are learning about you, could potentially take a little bit of information and bring it as a question to the home to implement? So how has it worked? Has it been the home that comes first, or has it been families will come and ask the home to implement?
Right. I think this is the first time we've kind of spoken about the case study in front of a family council. Before, the conversation I had with family council was on how to build our technology. And since then, we've just been doing all of our sales and marketing to the long-term care homes, just because at the end, they are the ones who are going to decide if they want to use this or not, because it's not just families wanting access, but also them being okay with us pulling information from their system, their staff being comfortable using our platform. So since it's a two-way channel, and right now our model works that the long-term care homes are paying for it, it's usually the administrators or the IT people or the executive directors, CIOs have come to us, and we've given them a demo on what the technology is. And then if they like to, then they bring in their clinical team, and then they bring in their family council team. But in the past, when we were just starting, we did kind of approach to the family councils here in Ontario that we knew that, hey, can you make an introduction? Because at the end of the day, I think families realizing that a tool like them can really help will also motivate the administrators to think about implementing a technology like ours. So we feel like a family communication, a family council channel would be a very strong channel to use to get into the home, to get into the to get the time and audience of the executive directors and administrators.
Wonderful. So I'll ask you my last question. Yes. So I've heard from families that when it comes to a resident from long-term care, maybe leaving to go to the hospital to receive treatment and then coming back to the long-term care home, there's not a lot of communication between the healthcare practitioners. So hospital, long-term care home, or long-term care home, and maybe the expert specialist they go to see in the community. So what role could Evoke play if it was implemented in the hospital and in the long-term care home to kind of help ease that continuity of information, so that way it's not lost between, one institution and another?
That is such a great question, Kathleen. And this is our long-term vision, where we want the data to flow as residents or patients are moving through different sectors of healthcare. And this is our big long-term overarching vision. Right now, I know the charting software, if a home is using charting software, then their charting software and the hospital's charting software are starting to communicate, but it's still not there. A lot of homes are still paper-based. So our goal that we hope once we get some more customer traction is to also integrate with hospital systems, so that the family has There's just one source of truth and one place that families can just come to and get access to all the information, because it's so frustrating to use one app for one thing and another app for another thing. So our long-term vision is to have one platform that just tracks the residents, the patient's information, no matter which healthcare system they are using, be it the hospital, be it the specialist, be it the community. So that is our goal, and hopefully in 5 years we'll be there.
Absolutely, yeah, because that is something when I was working with the deprescribing that came up, is just, you'd be surprised, the pharmacists don't talk to one another, and there's a lack of, I guess, communication, which you'd think would be there, and it puts a lot of undue hardship on family members and caregivers who have to be the ones who ask the questions and know the questions. There is a question. So someone wants to know, is it possible to view point-click care notations in real time? So when they're entered into the chart that day, like, can the family see it?
Right. So we do connect with point click care, and right now all our customers that we have are point click care users. So anything, how it works for our customers is, say a nurse enters wait in their point click care software for resident Amy. As soon as the wait is entered, it will directly come to our platform and tell, hey, Jane, who is, POA care for Amy. Hey, Jane, there is a new wait for Amy. So that information just flows in real time, not just same day, but really literally within 1 minute, it will show up in our platform.
Wonderful. Well, thank you so much, Farsha, for taking the time to chat with us and to let us know what Evoke Health is and what you do, and some food for thought for all of the people attending that, have a conversation with your council, let them know, point them to the website, have a discussion. Maybe, if it's something that you want to work on, that communication between your council and families and the staff in the home, this is one potential solution that you might be able to bring.
Oh, Kathleen, that is very nice of you. Thank you to the entire team at FCO for giving me the opportunity to present my case study and to tell families that, hey, we are here to help with communication that has been poor so far. Thank you. Thank you very much. Have a great day, everyone.
Thank you so much. I'm going to unpin there we go. Hi. So what I'm going to do now is I'm going to share a little bit about my screen. And so, as I mentioned, prior to joining FCO, I was working, I was the lab coordinator. So basically I was the person who wrangled all of the researchers, managed the budgets for a research lab led by Dr. Arlene Estelle. It's called the DATE Lab, or the Dementia, Aging, Technology, and Engagement Lab. And some of the work that she does is focused on using tablets for people with dementia and answering the question of, is it possible for people with dementia to learn to use tablets? She found that there was a lot of ageism and stereotypes when it comes to people with dementia and their ability to learn to use technology. And so she had a number of really interesting research projects that explored that, but I want to share one of the projects with you. So I'm just going to mute my mic for a second. I'm going to pause the recording, and I'm going to share with you the Act 2 Dementia website. All right, so you should all be able to see, this is the Act 2 Dementia website. And so what it does, it kind of researches or explains a little bit what Act 2 means. Basically, it's accessible touchscreen apps for people with dementia. And so they created a little bit of a scale that is used to assess how dementia friendly a tablet-based game is. And on this website, they will have recommendations and reviews of different tablet-based games that you could play. And these are games that maybe there's a little bit of a cost, but I find that most of what they do, they go for the free apps. And so you could pick by style. So if you want a board game, you could pick a board game. If you wanted puzzle games, you could pick puzzle games. You could also choose the system you're using. So if you're using Android versus Apple, if you want free apps, 1-player games, 2-player games, and then they also have a multilingual option. And the multilingual option is really cool because they will look at games that might be offered in that, native language. So someone came to Canada and English is their second language, then if they speak Spanish, or if they speak Chinese or Korean or Japanese, then they have apps that are available in those languages. And they also provide reviews in those specific languages. What I like is that they will give you some news about what's going on with their lab. And then they'll also share a little bit about the guides they have. So how can you actually go through the process of, using an iPad and getting started with using apps? What are some things that you need to know? They also do share some of the research that supports it. So there's a picture of Arlene and her colleague, Dr. Phil Jadrell, who is from the UK. Arlene is also from the UK, but she's based in Toronto now. And so it will show all the publications and give you links to the articles to speak about what it is that they're doing. So that's one of the really cool projects they have. So Act 2 Dementia, as I said, it is a free website that you can visit and you can explore different dementia-friendly apps that exist. So I know that one of the things that families were speaking about when it came to COVID-19 and when it comes to visiting and spending time with your loved ones, there's really not a lot of programs going on. Maybe group programs have started, maybe group programs haven't started. But if you have a tablet and you've already downloaded a game and the game doesn't need any Wi-Fi connection, then it is possible that you might enjoy playing a tablet game as part of your visit. I can give you an anecdote where when I started working for, it was based out of Ontario Shores, which is an inpatient mental health institution. And they do have a specialized geriatric unit with people with advanced dementia. And when we would take our tablets to that unit, there would be residents who were very quiet, who seemed very unresponsive to a lot of what was going on. But as soon as my lab mate, who was known to bring the tablets in, he would speak to her. So he'd call her out to come over to him, and he would point to the tablet and insist that she get one of the tablet games that he enjoyed playing out. And that was a keyboarding one. And now he didn't necessarily need to make music, but he enjoyed the cause and effect of, with the tablet, pushing the piano keys and hearing the sound that would come from that. And that was just such an unexpected response, and it really questioned my assumptions I had going into this unit. But I will say that the apps that they offer have been tested, are very popular. So things like, bubble popping or matching games or card games, or even just looking at fish swimming around in a pond. And if you tap the tablet, it will make a wave. It was quite well received by the residents. So I highly encourage you to explore the Act 2 website and see if there's any apps that you know that the person you're visiting or that you care for in long-term care may enjoy with you as part of your visits. So this is the DATE, Dementia Technology Engagement Lab, and they have done a number of research articles and studies. They will have calls for participation if they're looking for people to get involved in research or any publications. They'll have it there. I'm trying to find, where's the projects? Projects, there we go. So one that I'm going to point out to you is going to be Let's Connect. So Let's Connect, again, it was based on the assumption that people with dementia may not be able to learn to use a tablet. And so it started with implementing the Let's Connect program, where there'd be peer helpers or people helping people with dementia who are part of a day program in the community at senior centers would learn to use technology and learn to use a tablet. But beyond that, they also wanted to try to implement it within long-term care. So they did implement it within a long-term care home that was adjacent to a retirement home in a very remote community. I also know that they implemented it with a long-term care home, and they wanted the frontline PSWs to be the ones who would engage in tablets and playing the tablets with residents when they had time. And it was funny because I could tell that they hadn't worked in long-term care when they designed that study, because I would have told them, well, when do you expect them to have time? They won't have time. Maybe you should have trained the families instead and you would have had a different result. And so I keep going back to them saying, I'd really love to see them try to implement what they're doing with families. But they also do some things like Connect bowling. So if your long-term care home has a bowling game or a Wii or a Connect or Xbox. It's motion activated gaming, but they looked at the connection between playing, connect bowling, and fall prevention for older adults living in the community, as well as in retirement and long-term care homes. Mixed reality. So there are some innovations where there's a blend of digital with the real world. So people will be interacting with something they is in the digital world, but it will have some type of presence within the real world. So they're looking at how do people with dementia respond to mixed reality. And we've talked about that in book club when it comes to talking about virtual reality and dementia. So I'm going to stop sharing now. But as I said, I really do hope that you take some time to explore those websites and see what we have going on. We are now going to take a brief 15-minute break, and we're going to get back to things again at 2:30. So get up, stretch your legs, get a beverage, go to the washroom, and we will be back at 2:30 for the remainder of our session. So have a great bit of a break, and I'll see you at 2:30.
Can you see the slide there?
Yes. I
Perfect.
can. Go right ahead.
Great. Well, thank you for that lovely introduction, Kathleen. If you guys don't know me, my name is Dan, and I'm the founder of Bicep, a medical device, assisted device company out of Niagara Falls, Ontario. A little bit about myself: as I graduated with my bachelor's of kinesiology, my master's of applied health sciences, and well as in my master's, like any starving student, I started looking for work, and I started to work as a kinesiologist across many different long-term care and hospitals. And I found a manager who did our ambulation mobility training relatively unsafe and inefficient, very costly too. So, the first thing is that it takes two therapists to usually do this training. One therapist that walks with the patient and another therapist that falls behind with the wheelchair. And just having a second person on a part-time basis is a hit on our healthcare system, about $3.6 billion in lost productivity. Not their roles, but basically they could be doing other things and pushing the wheelchair from behind. And so what happens is oftentimes we're left with us as therapists trying to do the task of two by ourselves. So trying to work with the patients and try to do not only walk with the patients, but actually try to bring the wheelchair with us too. And this could lead to workplace injury. In fact, just in Ontario, 45% of workplace injuries in hospitals and long-term care homes come from patient transfers and ambulation training. And then, of course, because some of these patients or residents aren't walking on a daily basis, they begin to develop a fear of falling. And in most residents in Ontario, 36% of the patients have developed this fear of falling. And then lastly, we have some very brave patients, residents who decide to go for a walk without the necessary staff and equipment and end up having a fall with their assistive device. And the average cost of a fall in Canada with an individual with their assistive device is about $42,000 to the healthcare system. So in order to combat all these issues, we created what's called the ARM device. This device attaches the patient's wheelchair to the walker and allows the patient to walk with the walker while the wheelchair trails behind them at a safe distance, eliminating the need for that second therapist to push the wheelchair. It connects at one point on the walker and one point on the wheelchair as well too, using the pin style method or with our universal design as well too. And again, very easy to use for the therapist and for the patient to connect the wheelchair to the walker. But it's not only for ambulation; it can also be used for transfer mode. So transferring from chair to chair, perhaps from bed to chair, perhaps from chair to toilet, chair to shower, any destination that the resident really requires to go now can be used in the comfort of their own room. In addition, we also have exercise mode where patients can complete exercises in the comfort of their own room without having to go to the physiotherapy clinic or to the hallway and sacrificing their dignity. So that is essentially a quick video of the device. We'll go through a little more detailed demo after, but the device is in the middle here. It's, again, we don't produce a wheelchair, we don't produce the walker, we produce the device that attaches the wheelchair to the walker. And due to this, simple innovation, we've been getting a lot of coverage on how necessary it is. Especially nowadays when you have COVID and you just simply don't have enough staff due to people having to isolate or have been sick. So this is a great device, a term we like to call intervention by innovation. So allowing a lot more opportunity for the therapist, empowering the therapist to see more patients on a daily basis and do more with the patients just by using this simple device. Again, we have a transfer mode too. So these drop-down lights come down. Now the patient can transfer from their device to any destination: bed, chair, sink, counter, toilets, another chair, really anywhere they desire to. If they want to go brush their teeth, they can bring the wheelchair, use the device to transfer to the sink and brush their teeth. So again, allowing for more autonomy and a lot more independence for residents and patients alike. So this device is made from a lightweight medical grade aluminum. It is adjustable for height and for length to account for different patient sizes, as well as their stride lengths too. It is a durable frame, and it does have universal attachment that can attach to most wheelchair and walker brands right now. We did do a research study to determine the effectiveness of this device, and we tested over 60 patients in long-term care home. And basically what we did is we got them to do 3 walking tests with the device and 3 walking tests without the device. And after each set of walking tests, we gave them a set of questionnaires to answer as well too, to determine how they felt when using the device. So quick overview, the 3 tests were a 10-meter walk test in which they had to walk through 1 set of pylons to another as quick as they could within those 10 meters, a slalom walking test when they went through a set of pylons, a 3-minute walk test, which is more of an endurance test. They had to walk around a set of 4 pylons, a 30-meter track as many times as they could within 3 minutes. And again, they did it once with the device, once without the device. And after each set of tests, they were given a self-confidence questionnaire on their walking and a fear following questionnaire on their walking as well too. And when we look at the results indicated they actually increased their walk speed by 24%, increased their walking distance by 15%, which puzzled us because they're using a more robust and heavier system. So how come they're walking faster and further? When we take a look at the cognitive measures, we found that the self-confidence actually went up by 40% and fear falling decreased by 20%. So because they felt more comfortable knowing that the wheelchair was always right behind them and they weren't relying on another human to follow them behind with the wheelchair, they were able to feel more confident and less fearful when walking, which in turn increased their ability to walk faster and further. So not only did we start working with older adults, we started working with a lot of, acute patients too. So, amputees, spinal cord injury, orthopedic outpatients, stroke, MS, ALS, Parkinson's, veterans. We started working with them. We found these similar trends that they're actually improving both their physical and cognitive components of walking. So then we started saying, okay, we'll go to the therapist. How do therapists feel about it? So we've done a bunch of focus groups, and 90% of therapists feel that this device would be useful. They would recommend it. They would use it on a daily basis. So again, we're the only device in the world that attaches the wheelchair to a walker. We are FDA Health Canada approved, and we've done clinical trials and found that this device is easier for the patients, safer for the therapist, and more versatile than any device on the market. To date, we've raised over $500,000 or just under, but this is all through grants from the government and pitch competitions too. So again, the device speaks for itself, and a lot of people see the simplicity, but the necessity for this type of device as well. And then the team consists of myself. We have Dave, my business partner, and we have Dr. David Detter, one of Canada's leading spinal cord injury researchers on the team as well, validating all of our clinical trials and ensuring that, we do have clinical trials to show the effectiveness of this device. And then our advisors, perhaps the most notable one is Dr. Bob Bell. He's a former Minister of Long-Term Care and Health for Ontario too. So is on the advisory board. He has used this device and he does recommend it to a lot of his fellow practitioners. And then again, this is a lot of research support we've been getting from a lot of institutions across Canada and the United States. Right now, we are actually in Ottawa working with Pearly Health. Pearly Health is Centers of Excellence for Long-Term Care. And basically what we're doing is we're doing a long-term study with them. So to measure the effectiveness of this device to be used on a daily basis. And what the goal is that with this device, we can actually do more ambulation and transfer training, which again, delays the ailments that many older adults would face when they're in these institutions, and we're going to try to keep them moving so that they don't have to transfer to that end of care unit, which again we all fear as well too. So that's the goal here. So now what I'm going to do is, before we have any questions, I'm just going to put my camera back on. I'm just going to do a quick demo to show you how the device works. So the way the device works is very, very simple. So the patient or the therapist can do it themselves. What they would do is they would put the device where the wheelchair leg rests are using the pin down method. It just slides in and then it clips it. And there's the leg up for a second here. And then all they gotta do is release this arm, and this arm will just click into place. Now the wheelchair and walker are connected, and now they can transfer. So again, for the purpose of this training, I take the brakes off the wheelchair, but most likely the therapist put the brakes on. But again, the patient would transfer from the wheelchair to the walker, and as they walk, the wheelchair is always behind them. And again, always evolve. Now, again, with the device, we do have the ability to turn on a dime here. Very easy to turn, because the way we designed this device is that actually the back wheels of the wheelchair are off the ground slightly. So now we're pivoting on the front wheel. So we're gonna put my hand back down on the wheelchair. Now the wheels are hitting. So again, slight lifting off the ground. It's not a safety issue, but again, now the patient can turn around corners, tight corners, can turn around the hallway too. And then when they're done, brakes go back on. They sit down, disconnect one, disconnect two, and pull themselves away. So again, a great opportunity for a lot of these patients to do it themselves if they have the complete independence, if not the therapist for them as well too. Again, I'll show you just quick in, connect, and then this one, quick in and connect, and then you're good. And now they transfer up and they start walking. As they start walking, the wheelchair is always behind them. Again, allowing them to walk with the wheelchair and walk connected. And then when they're done, they would just grab, sit back down, disconnect, disconnect, and now the wheelchair is separate from the walker. Also, what I want to show you is the transfer mode. So again, they would put their brakes on the wheelchair. These legs would spin down on the ground there. Perfect. So these ones spin down on the ground. And now the patient will be able to toilet as kind of this the toilet. They'll put their brakes on, they can grab the device and they can transfer to perhaps a toilet, sit down, finish their business again, and stand up, and then transfer back to the wheelchair. If this was their bed, you can get them into a seated position in their bed, and then they get from the seated position on their bed too, and then they're off. Same with exercise, the sit to stand exercise. So again, from a seated position to a standing position, or exercises, lunges. You can do squats, even hip flexion, extension, hip adduction, abduction. So all the exercise in the comfort of their room, never having to go to the hallway, sacrificing their dignity. And of course, when they're done, just simply take it out and then put it to the side. While I'm here, does anybody have any questions?
Yes. Okay. A few questions. So beyond having it used in long-term care homes by the staff, have you been approached by families, or do families purchase this so when they're bringing their loved one home for Christmas or for a weekend visit, it can support them with transfers and just have their loved one visit them at home?
That's a fantastic question. The simple answer is yes. However, one thing that we want to keep in mind is that, in institutions, the hallways are a lot wider. So connecting a wheelchair to a walker and walking with a wheelchair and walker is a little bit easier. But at home, the best thing about it is the transfer mode. So again, having family members come home, connecting this on, now the family member can be a little bit more at home. If they want to transfer to the couch, if they want to go to the bathroom to brush their teeth or go to the toilet, their families to rent the device out or just borrow it for a weekend for a lot of their residents too. So yeah, absolutely, there's no issue with it as well. One great story is that I was in a long-term care home, and about 2 blocks away there was a Tim Hortons that the residents, her room looked at the Tim Hortons every day, and she just was dying to go to Tim Hortons, but she never make it. She could only walk 10 meters at a time and having to sit down. So what we did is we went outside, we connected the wheelchair to the walker, and we made it to that Tim Hortons. It did take a little bit over an hour to get there, but we did do it. And again, this is the beauty about this device, is that you can actually use it outside too. So when you are bringing family members home, and if it's not too slippery or snowy outside, then you can do walking activities outside with the wheelchair and walker connected.
Thank you. So I know this because I saw your pitch for the HWell National Pitch Challenge, but what's the story behind creating this device? So what made you decide, and how did you involve your family in it?
Yeah, absolutely. So the story was that, I used to work for a government-run facility, and we only had 2 therapists twice a week, and that simply wasn't enough to walk with patients every single day or residents every day. So what happened is I would get approached by residents all the time. Hey, can we do walking? And I said, sorry, no, due to safety regulations and ministry standards, I can't do this on my own. I can't pull anybody in because we just simply don't have the staff. And I felt bad, I had a soft spot in my heart for a lot of these residents that wanted to improve or wanted to sustain their mobility, but couldn't just because of funding and government regulations. So what I did is I decided to build something that can, just help me in my own practice. Now, my first version, full disclosure, was a string that attached a wheelchair to a walker, which, didn't prove to be the most effective because after the residents would stop walking, the wheelchair would kind of hit him in the back of the leg and make him sit down real quick. But then I got me together with my grandfather, my late grandfather, who was a tool and die maker, and we built our first prototype in his basement. So me with the idea, him with the skill set, and we produced the first arm device, as we like to call it, about 5 years ago now, in his basement. And yeah, it's just a beautiful story that somebody that was, not young, but middle-aged individual working with his older grandfather to produce something that could help. Heartwarming story that we're able to do. Would be extremely happy to see that this device is getting to market and actually helping a lot of people that can actually use it on a daily basis.
Wonderful. Lots of questions coming in. So someone's asked, what is the cost?
It's a great question. So we are in the process of getting ADP listed. So ADP listed is the assistive device program. So that will be able to subsidize the cost of the device. Typically, we like to have one device amongst residents and patients. We would say one device for 10 residents. Right now, the cost of the device, because everything is manufactured in Canada, is just around the $1,000 mark. But that is to be shared amongst as many people as possible. But the goal is to get the pricing down through ADP certification, and as we start to build more volumes, we can get the prices down in the materials. If it was up to me, I would like to keep it as cheap as possible. But one thing we noticed is that after COVID, all the prices went up, all the metal prices, the supply prices too. So right now that is the price, but it won't stay there for long.
Thank you. So the additional clamps for connecting the device, are they sold separately or do they come together?
Yeah, no. So if you were an institution buying it, then we would supply the additional clamps. Basically, when you purchase the device, if you were an individual person device, you would have the universal attached with it too. So yeah, everything is included.
All right, question. Can families purchase the device for use at long-term care homes as they would a wheelchair or walker? And then I guess second to that, are you looking to maybe engage the physiotherapist to help teach families to use the device? So it'd be family directed as opposed to, relying on the home and the PSWs and staff to do all the transfers with the existing big clunky transfer assist devices they have.
Yeah, and that's a great point. So yes, we're absolutely working with all the physiotherapists too. So we've at this point right now, we are still we're still fulfilling pre-orders to extended trials for us. Early February, this device will be available for anybody, whether they're a resident, whether they're a family member, whether they're an institution or a therapist. So yeah, it will be available for family members purchase for the institution.
Oh, I think you're cutting out a little bit, but we're still here, Dan.
With this, okay. Can you not?
There you go. Yes, I can now. You're back.
Okay, sorry. It might be the internet connection. I feel like I'm in a bunker over here. It's not too much.
That happens sometimes.
Yeah. So short answer is that it will in February. It will be available for anybody to purchase. Right now, we're just working with the select few long-term care chains and hospitals, just to do extended trials as part of our validation to ensure that there's no more modifications need to be made to this device. But yeah, end of January, early February, this device will be available for anybody to purchase. And yes, we are working mostly with the physiotherapist team to train family members, to train other staff as well to use this device. It's a very, very simple device to use, a very small learning curve. And we have a whole bunch of videos that we'll be producing online as well too, to really help people learn at their own pace. I hope you got all that.
Yes, I did.
Okay.
Does it adapt to any wheelchair and walker model?
Yeah, that's a great point. So with walkers, yeah, 100% all walkers. With the wheelchairs, we attach to most. One thing you have to be aware of is that, you know, your tilt wheelchairs, they begin to get very heavy for a resident to push. So we can attach to them. We don't attach to electric wheelchairs right now, but typically we find that people in the electric wheelchairs don't have the capability to walk that far anyways. They would do more exercise modes, stuff like that. But yeah, we can attach, but again, what we always recommend is that, you know, depending on the strength of your family member, resident, or patient, you may want to put them into a transfer chair first to do the exercise, as opposed to bringing in their chairs, because some chairs can get pretty heavy and it might be discouraging if they have to walk with a walker and they're pulling a very heavy wheelchair too. But the short answer is yes, we have universal attachment attached to any wheelchair or any walker. I think I might have brought one of them with me. Sorry, I didn't bring them with you. I have a different attachment pieces, which I can send you links for that can show you the universal attachment pieces.
Perfect. Well, thank you so much. I do appreciate you taking the time to share your exciting product. And I am so excited to hear that in the new year, they will be available so families could, you know, make requests and purchase this device so they can use it, because I do think, you know, if they want to support the team and having their resident walking, or if they want to support, bring them home, like I just it's such an exciting innovation and so well needed. And I agree with you. It was so hard when you have to say no to someone because, you know, your support wasn't there. And in my case, I was the rec person with the physiotherapist. And if the physiotherapist was sick, then I couldn't do the programs I'd normally do. So same thing, it would be, you know, the benefits, you want to do it, but you can't. So thank you so much for joining us today and sharing a little bit about Bicep. And thank you.
No problem. And thank you so much for this opportunity. I did just send my email to everybody in the chat. If you have any other questions, if you want to discuss anything more, please feel free to reach out. I'm always happy to jump on another call or do demonstrations at any institutions or facilities that any of your family members are in. But yeah, I really thank you so much for the opportunity here, Kathleen. It was I always support any again organization that is there to help others as well too, and that's simply what this device is. This device was simply built to help people be more independent, to save their dignity, and to feel more comfortable and have a better quality of life. So thank you so much. And again, if anybody has any questions, please feel free to reach out. Our website is www.bicep.org as well too. So follow us on our websites and our socials as we begin to roll this out to the bigger population. So please follow us, and we look forward to moving on to the next steps, and hopefully we can do that with some of you as well.
It's so exciting. Thank you so much, Dan, and all the best to you when you do start that rollout, because hopefully you don't have the issue. I've been working with an organization trying to get trishaws that are used for cycling without age, and you would not believe what COVID did to demand for bikes. In the backlog for those materials.
Well, that's what we're facing right now. We were supposed to roll this out before the holiday season because we had that vision of, you know, people using it to bring their loved ones home. But the supply and demand chain is just ridiculous right now. So
yes.
It's out of our control. We're trying our best, but again, we're looking forward to the time that we can actually roll this out.
Thank you so much. Well, all the best to you. Thank you. Bye.
Bye, everybody. Happy holidays. Bye.
All righty. Well, so moving on to our next organization, and I'm trying to think. Let's see. I'll make you co-host. Yes, and make you co-host. So Cam and Carson, I'm not sure who's going to be talking and sharing screen, but you're both co-hosts now. So whoever does have the slide deck will be able to get it up and running. And you should be able to show your cameras and unmute. And I will let you, is Cam there? I'm not sure.
Yeah, he is. He should be. Yeah.
Okay. All right. Well, I will let you get started and take it away. I'm really excited to hear your session and presentation, and I will let you get started.
Yeah. I guess I'll wait till Cam
I'm here.
shares
I'm
his.
here, Carson.
Oh, perfect.
There we go.
Yeah. So perfect. So yeah, thank you so much, everyone, for I guess joining and listening to our little spiel. You know, I've been able to sit in and hear a lot of wonderful presenters. I'm super excited for this industry and you know what everyone's trying to do to kind of help bridge that gap. Just a couple quick notes. Obviously, we're Jerry. You know, we recently came first on day one at a software as a solution conference held in Ottawa. We actually ended up winning the Dragon's Den at the Orca conference that happened, I think 3-4 months ago, Cam, if I'm not mistaken. And you know, we're just to be able to listen and see all these wonderful solutions that are coming out there, just like ourselves. You know, at the end of the day, I think we're all just trying to find ways to bridge that gap between families and care homes and find more efficient ways to communicate. And with that said, I guess, Cam, would you mind sharing your screen? And I guess we can start.
Certainly, Carson. And just give me a second. Bear with me. 1 second. I'm going to pull up our presentation here. Sorry, just 1 minute. I'm having a little trouble here finding that screen.
I guess while Cam's trying to get that set up, so we are currently partnered with 16 homes right now, and we have another an option for another 10 homes that will be hopefully be able to partner in the beginning of new year. We're just launching all of our pilot programs now, and you know, as I mentioned, we're super excited just to be able to share a bit about what we're all about. So having said that, perfect timing. So Jerry, we're basically a software platform that connects families and their loved ones through technology and automation, and your families obviously in long-term care facilities or retirement facilities. We understand, you know, the stress that families face every day with their loved ones in a home, and you know, not be able to see them on every day. We're really hoping that, you know, leveraging Jerry, we'll be able to kind of relieve some of that stress and some of that anxiety on the family. And at the end of the day, you know, our goal is to make communication more effective and to really, again, bridge that gap between families and care facilities. And we want to be able to, you know, relay real-time data to you versus having, you know, families call care homes, you know, on a day-to-day basis, because we understand that, you know, from a care facility, from a long-term care facility, you know, there's just not a lot. There's a huge staff shortage, and we want to be able to help care homes at the same time, so that they can spend more time caring for our loved ones versus having to pick up the phone and answer some of our questions. And so, as I mentioned, you know, our goal is really to answer 3 questions: the social well-being, the physical well-being, and the emotional well-being. Jerry, we have 6 modules that you can see up here, which is medication, nutritional, family whiteboard, core health measures, reflection, and care home hub. All of these, you know, 6 modules allow us to kind of answer questions like, oh, how is our loved one doing? Are they attending any of the activities that the care home is currently hosting? How is my, you know, dad and mom doing? Are they eating enough food? What type of drugs or prescription are they currently on? All these questions just to kind of alleviate some of the stress and anxiety that we as a family feel when our loved one is not next to us. Ken, would you like to take this part?
Certainly. So the solution and benefits, how we achieve this is very simple. We integrate with existing EHR systems. So basically any system that the home is currently using, we want to make sure that adoption is as simple as possible. So we connect to every backend system that a home is currently using. So whatever the staff is currently doing today, we don't want to change that. We want them doing the exact same thing tomorrow, except with this layer of Jerry added on, which is going to integrate all of their systems, which is going to automate the data flow, which is going to go over to families and create that transparency that families currently lack. Families are now going to have information that allows them to understand simple questions like, did mom have her breakfast today? Did dad take his medication on time? Or did grandma, what was her last heart rate reading? Or what was the last time that we checked her blood sugar? All that information, all that transparency creates more involvement, creates greater collaboration within the care, and increases overall quality of care for the resident. Now, as a family, we now have more information. We direct answers to the right individuals as opposed to calling the home. We already know that 50% of the time that you call a home, your call goes unanswered. So by answering those questions at the onset, we're reducing that volume of calls. And now when you do have to call, you're calling for the right reasons. You're directing your call to the right people. So your calls are more effective and you're using your time more wisely from both the care home's perspective and the family's perspective. And how we work is quite simple. As I explained earlier, we're basically connecting to any EHR system that the home currently has. So 3 of our modules, they're based on data that's input from EHR system. The rest of our modules are very unique to our product. They're basically based on input that's given by families. And that's our reflections module, that's our whiteboard, and that's also our family whiteboard reflections, that's our care home hub. So those don't really require this workflow, but for the items such as core health, medication, and nutrition, whatever is being entered in the system gets automatically fed to Jerry. The family then communicates with Jerry. We have the POA who's linked to the system, and the POA then gets to decide, hey, which family members are going to have access. And Carson can allude to kind of how this workflow works for him and his family.
Yeah, so my mom's a POA for my grandmother, and we have a lot of family members, not just in Canada, but kind of overseas and international. And during COVID, it was really hard. One, we weren't able to see my grandma, but 2, my mom was the main source of, I guess, information gatherer, so to speak, for my family. And a lot of times there was a lot of miscommunication, broken telephone, and we use a lot of different sources to relay information. So when we came up with our solution here for Jerry, we wanted to kind of make that more efficient, make it easier for someone like my mom, who is the POA, to relay information. And now as kind of what we kind of define a circle of care, not only is my mom able to have that information and see that, my aunt, my uncles, and those that are overseas are now able to get access to real-time data without having to ask my mom some of the questions that that she would then have to call the care home and relay that question and get that answer and then pass it back to my aunt and uncle.
So here's just some of the features that we were discussing earlier. So Care Home Hub, that's one of the features where we allow the families to understand the activities taking place in a home. We also have a section in here for the family councils. So this is basically the care home communicating out to the families. Right now, care facilities, they try to communicate this information via email, via their website, via Facebook groups, or via a simple bulletin in the home. There's different methods to which they use. Some of them may get through to the families, some of them don't. What we're trying to do here is centralize that communication, make it more effective. You have a calendar feature that allows you to understand all the activities taking place in a home. Now you have that social understanding that, hey, I know what mom and dad are doing today. Announcements allows you to understand, hey, what's taking place in the home? What are some heads ups that I need to know about? And we're also based on our discussions with the family council, we're also adding a family council section to this that allows for family councils to update families on important events and meetings that have taken place and certain things that have come out of those meetings that they want to advise families about. So it's an integrated ecosystem that allows one-stop shop to understand everything that's happening inside a home. Because we all know that social and environmental well-being allows us to understand that, or not really understand, but allows us to get that comfort that, hey, I know what's going on in my day-to-day of my parents. And that gives us that comfort and that ease. We also have medication module. The medication module is basically a list of all the prescription and medication that your loved one is taking. Me personally, I was I thought very long and hard about this module because it really affects me. My dad is always, whenever I see him, he's always has this whole lot of medication sitting beside him on Sunday mornings, and I have no idea what medication he's on some of the time. So for an individual like me, youngest of four, I'm not the POA, but I still want to be in the know of what's going on. And I put that pressure onto my brother, who then puts that pressure on to the staff of the care facility. So it's always a vicious cycle of one family member feels like they don't have enough information, and it's just a chain of stress that goes up. So what we're trying to do here is provide a list of all medication that the individual is on. We want to inform the families about, hey, what time was that medication last taken? And also, what's the purpose of that medication? And all this information is automatically synced to Jerry. So there's no need for the nurses to go in and put information to the EHR, then flip systems and input it to Jerry. All of it's being automatically fed. So from their perspective, it's really saving time, because a lot of the times families like mine are calling and asking, did dad have his medication? Or a question about the medication, why is he on this medication now? All of that will be listed in this module. We also have core health measures. Now, core health measures advise us of all of the core physical indicators of our loved one, such as heart rate, blood pressure, blood sugar, steps. Now, all of these are already tracked by the home. So all we're doing here is syncing that information with the information that they're already tracking, giving us insight into the physical well-being of the loved one. And once again, it's about asking the right questions, right? Typically right now, when we call the home, we call blind. We're just asking about certain things about medication, but we also have other questions that we might want to ask. This allows us to ask those pointed questions, allows us to get smarter about our questions, and make us feel a lot more involved in the care of our loved ones, because we are asking the right questions and receiving the right answers. Now, reflections module, this module, we recently actually presented to the BC Coastal Family Association, and we're actually piloting with a home in BC as well, and they absolutely loved this feature. And what we do with this feature is try and gauge the emotional well-being of our loved ones. And like we mentioned earlier, there's your physical, there's social, and there's emotional. Physical and social, you can do that with data and also pictures and whatnot, and we have all those features. But emotional is something that's very hard to gauge through anything. And the best people who are in a position to gauge the emotional well-being of a loved one are family members. So what we've done here is created a module that takes you through a questionnaire. It's a very standardized questionnaire, and through our own backend algorithms, churns out a mood rating. We've tested it. This is very on point, and it allows you to understand not just you as the POA. Now imagine if I'm the POA, I fill this out. I saw my dad today, I filled out the questionnaire. It turns out, hey, he's happy. This information can then be shared with all my family members that are synced onto the application. Now they know the emotional well-being of my loved one. We can also share this information with the home that says, say for example, I take this online survey and it says that, hey, he's not feeling very happy. And the home, and it's no fault of theirs, they may think that, hey, he's got a smile on his face, he's feeling all right. But I know my parents better than a lot of folks do. And I know that that smile that my dad has, that's a permanent smile, regardless if he's up or down. But the way he's speaking to me tells me he's down. If I relay this to the home, they'll then be able to take more proactive care of him. So that's the bridge that that's the gap that we're trying to bridge with this, is that emotional well-being. And I know Carson has a few things to add on this as well.
Yeah, at the end of the day, what we really want to do is improve that collaboration, improve the overall communication between families like yourselves and the care home. A lot of times, even, as a real example, when I went to go see my grandma, she would share something with me and made me kind of feel like, oh, maybe she's not as well as I think she is. But then when we kind of had a conversation with the nurse or the PSW at a home, they were always saying, oh, she's doing great. And, just having this reflection module allows us to kind of reconcile and kind of, work as a team between the family and the care home to really understand how we can improve, I guess, the overall emotional needs of our loved ones. And it really, our goal here is really to open that dialogue and to have open conversations.
And then we have our nutrition and daily living tracker as well. So this one is basically answering the question of, did mom or dad have their breakfast and how much of it did they eat? or did mom and dad have dinner? So it basically tracks the percentage of each meal consumed. And this is something that the care home already tracks. And this gives us comfort that they're having their meals. And this is one of the more common questions that comes into a care home, especially from family members. It's a very common question that we've been told by the care facilities that needs to be answered, but also results in a lot of disruptions on their side when they answer a phone call and say, for example, they're filling medication and they're answering a simple question of, did mom have breakfast? All of a sudden that 2-minute call in answering that results in 10 minutes of rework because now they have to restart that process. So this answers that question and also creates more efficiencies within the home, which results in that greater quality of care. And then lastly is our family whiteboard. So family whiteboard is mainly about the family. This has nothing to do with the care facility. This is just simply, I'll use my example again. This is simply me and my brothers chatting about the care of my dad. Because right now we have WhatsApp, we have emails, all these email chains, all these WhatsApp messages, there's no context to them. You might be talking about your dad's well-being in one moment, then all of a sudden 2 hours later, you're talking about dinner plans. And then you're talking about the baseball game. So it's never a pointed discussion. And what we're trying to achieve with this is one-stop shop for all the information related to the well-being of your loved one. So I can go in there and I can type in hospital visit, and I can type in a small message about how that visit went. I can tag it. Then my other brother can go in there and he can type a message about latest conversation he had with them, what they discussed, and tag that. Now, as my third brother who hasn't had any of those conversations with them, if he wants to get caught up on everything, he can simply go through this and it's context based. He can just click on a tag hospital visit. Okay, there was a hospital visit. What happened there? And it's even better because from a context perspective, a lot of the issues that we have, a lot of the times that we feel stressed, that we feel anxiety, it's because we don't have context. We think of things in the moment, but we don't understand the context of why that's occurring. And when we get context in situations, it allows us to think with a more level head. So what we're trying to do with this is create that context that reduces that stress and anxiety because it gives us the history of what's going on. And this is another feature that we've been told from families is very useful in that regard. And Carson, I don't know if you have anything to add to that.
Nope. The only other thing, I guess, that I would like to kind of share is, we also understand that new technology, new solutions can be pretty overwhelming when we're trying to implement into an existing environment that might not traditionally have support around a solution like ours. And so, we also have a team that goes on site to the care homes and retirement facilities to not just train the staff on how to utilize our tool, but also we sit with each of the family members and the counselors that are associated with these care homes. And we train each and every single one of you to ensure that you guys are comfortable with our tool. The last thing we want to do while we're trying to solve a problem is leave the families and leave the care home stranded without really understanding how to utilize our tools. So we have the support and we have the team in the background to help guide everyone through, the smallest or the most, challenging part of our adoption of our tool. And I also noticed, I guess, a couple questions that's been in the Q&A. One was around, what if you don't have a computer or a device? I probably should have said this in the very beginning, but not only do we have a web platform, but if you have a smartphone or Android or an iOS, Apple or Android phone, you'll also be able to access Jerry through that platform. And from a security perspective, going back to the circle of care, before launching Jerry, we worked with the families and the care homes to go through a proper consent process to ensure that the personal health information that is being shared has a consent, not just from the resident, but also from the POA. And even with the information that gets shared amongst, what we kind of define as circle of care, the POA will ultimately have the control over what kind of information and which family members get access to this information. Did I miss anything, Cam? Is there anything else you would like to add on that part?
No, I think you covered everything, Carson. I just noticed another question come in from Naomi. What is the annual cost for Jerry? Will family members also have to pay for the app? So We charge the care facilities for Jerry. So there's a monthly charge that the care facilities bear. Now, if the care facilities choose this to charge this back to the family, that's up to them. Right now, the care facilities that we're working with are charging it back to the family at around $15 to $20 a month. But then again, there's other care facilities that are just absorbing the cost as well. It totally depends on how the care facility is managing the cost for Jerry. And they're adding it as an ancillary service.
I have a question. So can families set alerts? So say I know that my loved one hasn't been eating very well and I want to be notified if there have been significant changes in their weight. So can the My Jerry app let me say, I want to know and I want to pay attention to when their weight might drop below the significant threshold that I know is concerning for their health? Can I set those alerts so then it will let me know that if that information is entered into the chart, it will just preemptively let me know that I need to have a maybe call or follow up with the home?
Kathleen, as always, excellent suggestion. We don't have that just yet, but I mean, that is a phenomenal suggestion. And that's something that's not difficult to add. We can definitely look into adding an alert system for families. Like it can almost be, hey, if the weight or blood pressure or heart rate drops below a certain level, we can, because we have push notifications right now anyways. So families can choose to turn on or turn off the push notifications with any updates that come through. So it's not so hard or so much of a reach to set those limits and send push notifications on if anything's dropping below that threshold. But as for now, we don't have that, but that's definitely something that we can incorporate within there.
Yeah, I'm just thinking, I know. So I mentioned earlier, my mom is a caregiver, the medical POA for my great aunt who lives in another state. She lives in Michigan. And just being able to know about her weight, because she has gone through the process of, she's lost a lot of weight. Now, granted, she's over 90. So any year past 90 is a blessing. But my mom's been concerned about her weight and the threshold. So I'm just thinking, like, being able to say, can you please let me know if it drops below something? Then it would prompt her to put in more of an effort than she does to call the home. Because similar to a lot of other caregivers, she knows the home is very busy, and when she calls, people don't always pick up. So she doesn't want to overburden them by being that, because she has been called that overprotective mom in other healthcare environments. And so she's really hesitant to put more on, but like just to have those notifications and to be able to justify the call by saying, I selected this as a notification. It's told me this information's in. Feel like we need to have a chat. It kind of, I guess, gives them the data to support that need for communication. So it almost like tells them, yes, there is a reason, and it focuses that communication between the teams. So I'm really, if it can do that, that would just be so exciting, because I think it will help. And I'm seeing there's more questions showing up. Oh.
Yeah, I think Lynn had a question. Can they give an approximate monthly charge to the home, i.e. 100 beds? So, I think as you see it on our slide, we do have 6 modules, and part of our implementation and onboarding process is we kind of sit with the home and kind of understand, and we partner with the family councils within each home, and we kind of understand like which modules are best suited for their existing environment. Obviously, part of the implementation, we roll out all 6 modules. So from a cost perspective, we want to make sure that we're scaling properly. So if you don't, out of the 6 modules, if at the end of the day, the families or the care home says, oh, only 3 or 4, then we basically charge, Cam can correct me if I'm wrong, since you're in the finance part of our business, but we basically charge anywhere between $10 to $25, depending on which module gets enabled and which module gets disabled.
Yeah, and just to correct Carson there a little bit, five is the bottom, 5 is the minimum that we'll charge. Yeah, 5 is it goes anywhere from $5 to $20 or $25. And once again, we work with the home. Our goal is to get Jerry out to as many individuals as possible. And our pilot program is, when we implement Jerry for the first 3 months, our pilot program is free, because we don't want to charge homes anything until we know which modules are the most useful for the facility and most useful for the families. So when we have that user acceptance from the families and the home, That's when we work with the home to come up with the pricing plan with respect to how we're going to charge out Jerry to the home. And on top of that, with the home, there's no cost to the home unless the license is turned on. So say, for example, you're a home with 100 beds and only 70 people or 70 residents, families are actually using Jerry. We're only going to charge you for the 70. We're not going to charge you for the 100. And say, for example, during the month or 1 month, so one individual drops off, then we'll start charging you 69 the next month. So it's not a fixed contract. It's only fixed in the terms of price per bed. But the number of beds can vary, and we have the technology in our back end from a billing perspective to only bill you for the amount of contracts that you're actually using, the amount of licenses that you're actually using.
And I see there is a question about, sorry, I just turned off, time required by the home staff to implement the app. So how much time is required from the staff, or is it adding extra time to what the staff would be doing to share this information with family?
So there's absolutely no additional time for the frontline staff. There's absolutely no additional time because you're already charting a lot of this information to the EHR systems. We have an agreement in place with Point Click Care where we're currently working with their sandbox and pulling data that's already being entered into Point Click Care. So the way that you should envision our application is we built roadways for medication, built a roadway for core health, built a roadway for nutrition. Now, where we connect these roadways to, we understand each facility uses Point Click Care and Yardi and Telehealth, all these programs in a different way. One home might track core health in one module or different aspects of the same module. All we do is we work with the home. Our first step is to work with the home to map that out. And then after that, the only education that really takes place is for the administrative staff to turn on and off licenses. Once we have the initial mapping of the information, after that, there's no additional work added to the frontline staff because they're already inputting that data, and the home can decide, okay, well, if that data is being input 3 times a day, they can also just dictate, okay, what time do we sync that data with Jerry? And then once that's decided, we sweep all that data at that time, and that gets pushed to Jerry. So there's no additional work required for the care facility staff. What they do today, they'll continue doing tomorrow. The only side that'll have to engage with Jerry will be during the onboarding process when they turn on or turn off licenses, and that's about it.
Thank you so much. And I'm just checking to see if there's any other questions, but I think you've done a really good job of answering all of the questions from those who are on the call. And I just want to thank you so much for taking the time to join us and to share a little bit about My Jerry. And it's, again, an exciting, innovative technology that supports communication between homes and families, and just even just the option of the family council portal I think is exciting for a home as a way to digitally connect council members, because it has been such a challenge with COVID-19 for family council members to get information the way they usually would, which would be like you'd have a bulletin board where everyone could see, or you could see people and remind them of something in passing in the common areas or at programs, which because of COVID protocols, you aren't doing that. So it's really exciting to hear that there's an organization that not only wants to promote that communication between the essential caregiver and the care team and understanding what's going on with their health and the care for that resident, but also in supporting the communication between family members, which is equally as important. So thank you so much.
Thank you so much for having us today.
Time. Thank you so much, and happy holidays, everyone. Bye.
Yeah, happy holidays.
Thank you. And I am so excited. I think, Dan, I don't know if I made you co-host yet. Let's see. Yes, you will be co-host now. So Dan, you should be able to share your screen. And I am so excited. I can't believe this afternoon has flown by as quickly as it has, but I'm excited. We have our last organization presenting, Moditech. And again, the kinesiologist and rec therapist in me is very biased to hear about this really exciting, innovative technology for long-term care. So I will let you take it away, Dan.
Excellent. Thank you, Kathleen. My compliments to you and your team at Family Councils of Ontario. It's been an amazing afternoon. I'm so excited about what's going on in this care sector. There's so many wonderful innovations coming out that are going to be improving the quality of life for those that call long-term care home and those that are working in the care sector. And we all know that they need that support these days. So let's see if I can share my slides successfully, and I will tell you some stories. Okay. Perfect. So I work for a company called Motitech. We tell people think motivational technology. We actually come from Norway. That's where we got our start. But I am in beautiful Ottawa, and as a firmly a Canadian company now as well. But we are active on social media. So make sure you take a look at our Facebook, if you're on Instagram or Twitter, and you can see some of the stories and the pictures of our life cycle. So this picture is all too familiar to everybody. Norway looked at this and said, this is not fair to those that are calling their nursing homes home, and we need to improve the quality of life for these individuals. We at Motitech agreed with them. We said many of the age-related disorders are caused by inactivity itself more than just aging. And too many are feeling lonely, especially with COVID-19, losing those abilities to walk and the ability to get outside. So the care homes in Bergen wanted to address this. They went out and purchased what's called active passive pedalers. They're passive or active assisted because there's a motor that helps drive the legs forward. Thinking people with severe arthritis, post-stroke, or later stage dementias that need a little bit of support to make that full rotation. Cycling with a device like this is very inclusive. You can see this lady's participating from her wheelchair without the need of transferring. She doesn't need to maintain that core strength that she's sitting on a bike. It's very inclusive. You can actually put upper extremity handles so you can be participating even if you're a double amputee. So these bikes were a great purchase for them, but people are people. And without the right motivation, the residents did not want to stay on the bike long enough to get the therapeutic benefit, and they didn't really want to come back for another session the next day. Instead, they were more interested in watching a concept called slow TV, where a video and film production company put a camera on the front of a train as it went by the countrysides and the fjords of Norway. And the residents were hooked. They started to reminisce. Oh, just down here is the lake my father and I went fishing. Just down here is the village I grew up when I was a little girl. And say, wait a minute, you grew up in that village? Well, so did I. And they would start to make these social connections. And they didn't want to leave the TV set. So the staff got innovative. They said, well, we've got these bikes that we purchased. This is what we need them to do to improve those physical outcomes. But they're more interested in this TV broadcast. So why don't we go out and make similar videos from our local community? They reached out to our team who were doing video production at the time, and we made 5 local video routes from the streets of the nursing home, and we delivered it on a DVD for an evaluation. Now, this is over 10 years ago, but they evaluated the engagement and the outcomes with just the bike and the bike plus the videos. They did 24-hour registration of behaviors, and they did all sorts of outcome measures. I'm not going to try to announce that Norwegian word at the top of that data here, but I'm just going to skip to the benefits. Again, this is from 2012. The staff highlighted benefits in 3 domains: the physical from the pedaling, and increased appetite, better sleep, better mobility, reduction in falls, loss of weight, and decreased pain medications. But there's also those cognitive benefits of that reminiscence and self-efficacy. I can do this. And the mental well-being and the anxiety and distress and aggressive behaviors were reduced or eliminated, as they said. I got to know MotiView, taking you back a little bit, from a research project during my postdoctoral fellowship at the University of Ottawa. There was a gentleman there that was in a wheelchair, and he was reclined a little bit, and he was a little bit agitated, much to the embarrassment of his wife, who would often leave her visitation sessions. I had the opportunity to bring him to the bike, and I found a video that was familiar to him from Quebec City, and you could see his eyes opened up and his feet started to pedal the trip. And he got lost in the video. The 15-minute video ended, and he got aggressive, and he looked at me and said, "Hey, encore," which means again. And we went for another 15 minutes. After that, he was sufficiently fatigued, I suppose, and he had a nap. And the staff came in and said, "What did you do to him?" I said he needed to move the body. And it was absolutely amazing to see those aggressive or agitated behaviors eliminated. But also those social benefits, that social connection that I talked about, where people start to share stories with each other and build these social bonds, not just between cyclists or residents, but between staff and cyclists, or even relatives, as grandchildren would come in and pedal with their elders and learn their stories. So all this to say, they increased the quality of life for those that were pedaling. So our team said, well, this is too good just to stay as 5 local video routes on a DVD from here in Bergen. We need to scale this up and spread the joy around the world. So they commercialized it and called it MotiView. Tell people again, motivational viewing. We still focus and hear a lot of stories in those 3 domains of physical, social, and cognitive. Here's an example of a MotiView session. You can see different types of bikes and multiple cyclists participating at the same time. Perhaps the staff member is a tour guide of her local streets and her childhood memories. You can see the laptop is running the software and it's connected to a TV. So even those that are in the room that don't want to participate in cycling can still enjoy the scenery and the music that's accompanying it. You can see they're using a wide variety of pedalers. Perhaps the lady on the left has a little bit more core strength and she can sit on those upright bikes, whereas the lady in the foreground perhaps needs a little bit of assistance, so she uses that TheraTrainer that they have in Norway. One of my favorite devices here in Canada is actually called the Exflex. They've got an office right here in Ottawa as well. This is a wonderful piece of equipment that your family councils could look into. It's got that passive motor that helps drive the leg forward. They also have a tabletop version to engage them in the upper extremity, which is great for transfers. So take a look at exflex.com. Kathleen, if it's okay, I'm going to try to share a video, but let me know if you can't hear it, okay? This video is from the UK. This is Sylvia. We just plopped a video camera down when we were in her care community, and we said, well, what do you think of MotiView here as she rode the bike? And so I'll let Sylvia take it from here.
I cycle twice a week, but if I can nick in for an extra one, I will do. I'm 96 years old. When you get to my age, which please God I hope you do, it's excellent to be able to exercise. So being given the opportunity of going on a bike and feeling, well, you know, maybe I feel a bit younger today. My favourite place, Tel Aviv. I mean, how many people can sit here when it's raining outside, be in Israel? Not many. You feel as though you're actually in that place. So if I hadn't been to Italy, or if I hadn't been to this place, I could choose it and then feel, oh my goodness, when I see my family tonight, I'll be able to say, guess where I've been today? I've been to Italy. Let's put it this way, it makes you dream a little bit. I really can't give you any way at all that I can say that I don't enjoy it. It's just, I feel alive. I'm going to put it that way.
I really wish I could say that Sylvia is actually on our payroll, but alas, she is not. We just put that camera down and let her speak. So we're in over 500 care communities now in 7 different countries, estimate 10,000 plus seniors using MotiView daily. Our video library is also scaling. Here's some of the video routes that we had. Obviously, COVID-19 has put a damper on our travel plans over the past 2 years. And the way we design these video routes are in collaboration with our end users. We say, where are your cyclist memories from? And we go out and we film them. Obviously, we can go to places that people have had their honeymoon. If anyone recognizes our beautiful Niagara Falls. Or perhaps they went to Europe for their honeymoon. So we went out to Paris and created a nice video around the Eiffel Tower. You can see that the videos are filmed nice and slow, so that everybody has the opportunity to look at the video and say, yes, that is the dog that I had growing up. All right, I'm going to change gears. I'm going to put on my hat for the next part. This is my favorite part of working at Motitech. This is the Road Worlds for Seniors. It's a bit of a mouthful. We didn't come up with it. We actually are partnering with UCI, which is a Road Worlds Championship for professional cyclists. In 2017, it was hosted in our hometown of Bergen, and they wanted to make it a community event, get everybody pedaling. The kindergarten, the schools, and places of work were pedaling, but there was really no focus on the seniors living in care communities. So I thought, well, hang on, we've got cyclists too that can participate. So we harness that competitive spirit and we run our own Road Worlds for Seniors. And this is what the care homes look like during Road Worlds. People are flying flags and cheering on their dedicated athletes. It's absolutely amazing. Last year, despite COVID-19 rearing its ugly head, we had over 5,600 participants from 7 different countries participating, over 260 teams, and they went collectively 183,000 kilometers. Again, these are individuals that are in their 70s, 80s, 90s, over 100 years old, perhaps living with dementia, post-stroke, with arthritis, MS, you name it. And they accomplish amazing distances. I'm going to show you one more video that just shows some of the excitement that Road Worlds for Seniors brings.
Ready, set, go!
Absolutely amazing year for Road Worlds for Seniors. My favorite part of Road Worlds is actually the medal ceremonies. Every participant gets a medal regardless of how far they go. If you went 2 kilometers, you contributed to your team, and that's great. We're going to celebrate with you. Some people accomplished 200 kilometers, and that's great, and we celebrate with them. We crown champions as well, right? Champion for the men's division, who went the furthest in the world. We crowned a champion for the women's division, again, who went furthest in the world, and the best overall team when it comes to total distances. Now, my favorite award is the best support team. We know how hard staff work to improve the quality of life for those that call long-term care home. And so any staff that go above and beyond for their teams, we award them the best support team of the year. We say no athlete is complete without their support team. And these medals are no small token for people. Just the other day, I was looking at one of our customers' Facebook page, and sure enough, there was, oops, I keep going backwards, I apologize. There was a lady decorating her Christmas tree, still wearing her Road Worlds for Seniors medal. Now, this is 7 weeks post-medal ceremony. And they wear these medals with pride. It's a sense of accomplishment, and it's quite moving. So, Kathleen, if it's okay, I'm going to stop there because I would love some dialogue with everybody. And what do you think? What types of questions do you have? Do you see this working with your loved ones in your care community?
Sure. So if you want, feel free to type in questions in the Q&A chat. Obviously, one of the questions will be, how much would it cost to have, you know, a Moditech bike in your home if you have one?
Absolutely. So that's a great question. I will save the cost of the bike for the producers of the bike. We are actually a SaaS company producing ModiView and the Road Worlds for Seniors. As I said earlier, it can complement any type of bike, right? The bikes can range from $20 inexpensive A-frame pedalers that may work for some people to upwards of $6,000 to $7,000 for the Type 2 medical devices that are used in some homes. So there's a range with the bikes. When it comes to our services at Moditech, producing new videos in collaboration with the sites, full support, whether it be training or tech support, all access to the videos, even the new ones as they come out, and Road Worlds for Seniors, where we'll send you hats and t-shirts and all the medals. And it goes from $200 a month for that package, right? Again, just like the other innovators on these panels, we work with the care homes to make sure that the budget is not the only barrier to implementation. But that's where we start with homes.
So for the videos, how could a home or an how could someone, you know, recommend a trail or a video?
Oh, that's a great question. So we make videos with all of our sites that implement ModiView. We have a platform that can help design the route with Google Maps. But we love hearing more feedback. We know that we need to head down south and make some of those Caribbean videos. And believe it or not, we get a lot of volunteers for that. But we design it in collaboration with not just the staff, but also the residents too, right? Where do they want to see? For example, if we're working out in Saskatchewan, beautiful Saskatchewan with the wheat fields, a lot of people grew up with those combine harvesters. Well, we got to make sure we go out during harvest and we can pedal down those streets to get the combine in view. And they say, yes, that's the type of equipment I used to drive when I worked on the farm, right? And the feelings of reminiscence come forward.
So I saw it in the videos. There were some people that were doing an arm bike. There were some people, you mentioned pedal assist. So what is a pedal assisted bike?
Oh, that's a great question, Kathleen. So pedal assisted is actually something that has a motor right in the bike. So you can turn on the bike and it will pedal without any feet on the pedals, right? So when you put your feet or your arms on these pedals, it will help drive your arms forward. So if your loved one is having trouble following instructions, when the pedals start to move forward, that's a very familiar feeling. And I've seen them override that passive motor and start to actively pedal, which means they're using their muscles now instead of the machine moving their legs for them. Hopefully that answered your question, Kathleen.
Yes, it did. So typically in a home that has them, is it, you know, the kinesiology department that would have the bikes, or is it the rec department, or is it kind of a collaboration between these two departments?
It's a huge collaboration. It's, again, site dependent. We've got some sites that use it predominantly in their physiotherapy room, but then the rec team will borrow it for a special event. One story I love to share is from Kama Woodlands in Burlington, Ontario. They use ModiView during the Road Worlds for seniors as a cultural event. They'll pick a country like France and serve food and wine and fly flags from that country. So it's really a recreation department driven innovation. Physiotherapy loves it because it's helping them reach their activity goals, but also PSWs and nurses. We heard people mentioning sundowning. Mark was talking about those sundowners. When they have that energy they need to expel during the evenings, well, pedaling with ModiView, the way it's a nice, calm ride down a beautiful place with the physical component helps people get rid of that energy in a productive way. So we've had nurses and PSWs using ModiView. Talking about the staffing crisis, I'll share another story from Norway. They have collaborations, the long-term care homes, that is, collaborations with NAV, which is a government-run program where they acquire funding for refugees and newcomers to go into these care homes, and they're called cycle hosts. So they'll sit with the residents and they'll pedal with them, practicing the language and learning about Norwegian culture. So it's truly a win-win-win where these cycle hosts, paid refugees, are working in the care sector. The care home is getting paid staff and the residents are getting activated. So it can be a cycle host program, or it could be an intergenerational program. We have some homes that engage high school students because the pedals can be very easy to use, very safe activity. ModiView itself is easy to use. So sometimes the high school students will put on ModiView and then again, sit with the other, maybe pedal themselves and hear those stories. So as an intergenerational program, as I said, ModiView is very easy to use. We try to keep it as simple as possible. So tech savvy people can use it themselves. We've got residents that will go up and select France and revisit Paris, or maybe feeling a little adventurous and they'll go to Dubai, or maybe somewhere in India today. So yeah, you can absolutely use the software yourself, but again, it's truly site dependent, Kathleen.
So a question about the videos. So do homes need internet access to retrieve videos, or is it loaded into a laptop or like a flash drive or a disc that is played on in-house without needing the internet for viewing?
That's a great question. We've listened and learned to our user sites over the past 10 years, and we know that some sites are blessed with a good, strong internet connection. I think that's great, especially during the pandemic. But we know that some sites, especially those rural sites, don't have that good, strong Wi-Fi. And if they do have any form of Wi-Fi, well, then they need to reserve that for the staff. So what we do is encourage sites to purchase a device, and we can provide them at cost, that is used to run ModiView, and then the videos are downloaded. So you do have to have internet connection to acquire them. We can always front end load them from our office before we send the laptop. But then you download the videos and then you can play them seamlessly without any internet connection. Very important.
Wonderful. I absolutely love your passion when you're speaking about Moditech and just enthusiasm, and myself just, you know, having that same excitement, seeing all of these benefits that it brings, the road worlds for seniors. I just truly want to thank you for joining us today. I'm just double checking to see if there's any other questions. I'm not seeing any, but you know, you've done a really good job, just sharing what it is that you do, but also just sharing all of the additional aspects to not only is it like a technological, you know, really cool innovation of a bike where you can see a video, but it's also a social aspect, right? With the road worlds and, you know, this, you're competing, but you're not physically in the same space. It really is so innovative and so exciting to see that this is happening within the sector. So thank you so much, Dan, for sharing your expertise and your knowledge with us today.
I'm more than happy. Thank you so much for the invite. And thank you to all the family council members that are on the call for serving on your family council. Your care home needs it. So thank you for your service for sure. Take care, everybody.
Thank you. Oh, and thank you for sharing your contact information with us. So on behalf of Family Councils Ontario, I do want to thank everyone for joining us for our first ever Innovation Summit in the second day. It's really been exciting to hear about all of these different innovations and products and solutions that are available. Hopefully it's given you some ideas of things that you can talk about within your own family council at your next meeting that are helping to move beyond COVID-19 and looking at different ways you can bring life within your long-term care homes and really make it feel like a home and a vibrant community that we know they can be. Thank you so much for joining us, and I hope that you all have a wonderful rest of your day. Thank you so much.